In this episode of the ASC Podcast with John Goehle, we cover the latest on hospital industry strikes, the need for non-generator-backed outlets in the OR, offsite sterilization, deemed versus non-deemed status surveys, and in our focus segment, we have an interview with Rommie Johnson from ACHC as part of our accreditation organization series.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 268 of the ASC Podcast with John Goehle, recorded on January 20th, 2026 from our studios in Spencerport, New York. I'm Sue Cronkite, your co-host and operations manager at Ambulatory Healthcare Strategies. As a reminder, the regulatory landscape for ASCs is constantly changing. The content in this episode reflects the most current information available at the time of recording. We encourage all ASCs to remain vigilant and keep up with any updates or new guidelines released by their relevant regulatory authorities. Joining me today is John Goehle, owner of Ambulatory Healthcare Strategies and one of the leading experts in the ambulatory surgery field. With over 3 decades of experience, John has authored more than 10 books on the ASC industry and is a highly regarded speaker on topics related to regulation, accreditation, and finance management.
Sue, I am freezing down here. We're in upstate New York. It is very cold weather right now, so I hope all of you are a lot warmer than we are. Of course, we live in western New York, upstate western New York, but Buffalo is far worse than we are. Our employees out in Buffalo, we just basically tell them to tell us when they're not snowed in as opposed to when they are snowed in.
I know. We'll get a few inches and they get feet.
That's right.
But we do have the temperature, so that are just, I think the what it feels like temperature with the wind chill and everything over the next week or two is going to be sometimes in the negatives. So we're just staying in. If
there are any organizations that would like me to visit and you're in the South or in very warm weather, just give us a call at AH Strategies. We do have some sad news to impart. Our dear friend Ruben Garcia, who is a friend of the podcast, he's been on the podcast a number of times. He was also a surveyor with AAHC. Unfortunately, he passed away as a result of complications from surgery last month. And we're sorry that we haven't mentioned this up until now, but prayers for his family. He had 4 children and, of course, a wife, and he is going to be very much missed in the industry, so we just wanted to recognize that. We have a pretty packed episode today. We are continuing our series on the accreditation organizations, and with this episode, we're going to be interviewing Rommie Johnson with ACHC. But before we get into that, Sue, why don't we have an update on the nurses' strike and strikes in the healthcare industry in general?
Yeah, I was looking into this. As we had mentioned, the New York City nurses strike in our last episode. And I found nurses strikes in the United States have actually increased significantly with over 30 strikes in 2023. That was the most recent definite numbers that I found. And that's compared to only 9 in 2020. And as of January 2026, major labor actions are continuing, including a strike by 15,000 nurses in New York City over safe staffing is one of the issues. The frequency of strikes has more than tripled between 2020 and 2023, and this is driven by burnout, staffing shortages, and salary concerns. I wonder if some of it may have to do with things that just got worse with the pandemic.
Yeah.
And of course, things like this just snowball. The fewer people you have, more burnout, the fewer people you have. So,
well, I do think that it's also the low unemployment rate right now, the fact that there are just not that many people out there. It's not just in nursing, it's really in the tech positions also. And I think that puts a lot of strain on everyone, and especially nurses who really, carry the weight in many of these hospitals especially.
Yeah, but as you said, the technical workers. So at Multicare Yakima Memorial Hospital in the state of Washington, they began a 10-day strike on the 17th of this month, January 17th. The workers include employees who assist with surgery, radiology, MRI, pharmacy, and lab work. And they claim that since Multicare took over the hospital in 2023, that they have reduced employee benefits and they've instituted some policies that they consider to be detrimental to patient care. And as for the nurses in New York City, they are on the 11th day of their strike.
Yeah, and there's been a side effect of this, too, in that we are waiting for some surveys, some pre-opening surveys, and they look like they're being delayed right now because the Department of Health is closely monitoring the situation in New York City. My understanding is that they're making more frequent visits to these facilities to make sure everything is going all right as a result of the nurses not being at work. So more to come on that. It'll be kind of interesting to see what the fallout is. And, of course, the longer the strike goes on, the more problems that we're going to have and more of a backup probably we're going to have with healthcare in general. So in this episode, I thought we would talk, Sue, about some issues that have come up, with during surveys, with our clients at AHS, and just some general conversations with other surveyors and other people in the industry. And one issue that was brought up recently is that one of our centers experienced a power failure in which, when the power came back on, the transfer switch didn't properly transfer power back to the grid, which resulted in the outlets that were powered by the generator not actually being functional afterwards. And this is, I used to wonder why NFPA requires ambulatory surgery centers to have at least one operating room outlet that is not tied to the generator. So the reason for this isn't just convenience. It's actually to make sure that there is a fail-safe program, and that's what NFPA. That's why NFPA requires it. So when utility power is restored, the transfer switch is supposed to move the operating room power back from the emergency power to normal power to the grid. But transfer switches don't always return cleanly or completely. And as I mentioned just this last week, one of our clients had that problem. Luckily, they had other outlets in the operating room that were not on the generator, and they were able to quickly get back into business. But it does bring up the importance of making sure that in each of your operating rooms and in your treatment rooms, you do have at least one outlet that is not tied to the generator, that you can immediately unplug things from the outlet that's tied to the generator to this grid power. So, and this is something that you're going to find surveyors asking during a survey. I know when I was a life safety surveyor, that's one of the areas, or one of the things that I had to always look for. So if every outlet in the OR is on the generator, you can end up with power in the building, but dead outlets in the room when the power comes back on. So as I said, this non-generator outlet is a built-in fail-safe, and it gives staff immediate access to stable utility power if the emergency system doesn't transition properly. Another issue that's been popping up more and more frequently is offsite processing of instruments and, sterile processing or high-level disinfecting. And, there's a number of reasons why this, I think, is popping up. One is that sometimes the sterilization equipment goes down in your surgery center and you're looking for alternatives. Maybe, asking another surgery center to do sterilization for you, or using an offsite processor, or using your local hospital. And of course, your doctors sometimes think that they can save money by perhaps not having the sterilization done in the surgery center and having it done somewhere else, or sharing that responsibility with another center. And then lastly, you might have a sudden need for more capacity. Maybe you've had a very sudden increase in the number of cases you're doing, and you just need to be able to sterilize more instruments. Or whatever the reason, there has been an increase in the number of people requesting information about offsite processing of instruments. So Medicare-certified ASCs can use offsite sterilization or high-level disinfection under a contractual arrangement. So it's not something that you can just do automatically. You have to have some type of an arrangement with that other organization that identifies what the contractual relationship is between the organizations, the fees, and of course, who's going to be responsible for any failure of sterilization. So let's just kind of go through what you need to do. First of all, you need to confirm what's driving the change and what will be actually sent offsite. Is it going to be everything that you need to have sterilized? Is it only going to be certain types of instruments, et cetera? And you're going to want to define that in writing. And of course, all of this needs to go through the quality improvement and governing body. And then you're also going to have to determine what process is going to have to be done offsite. Is it going to be sterilization? Is it going to be high-level disinfecting? Is it going to just be cleaning and decontamination? And, what's the storage going to be? How are you going to transport this back and forth between the organization? As well as determining what the turnaround expectations are going to be. What type of downtime you might have as a result of it, whether you're going to have any backup inventory on site, et cetera. And, of course, also if there are loaners. So why does this matter, by the way? Surveyors do ask this question. I ask this question when I'm doing a survey is, do you have any offsite sterilization that's done? Before you embark on this, you do want to do a formal risk assessment for infection control and operational purposes. So you definitely want to look at the pros and the cons of doing this and make a determination based upon what's right for your organization. Mm-hmm. Next is you want to select and qualify that offsite processor, be it another ambulatory surgery center, or there are other vendors out there, or even hospitals might be willing to do this offsite processing for you. And you always remember the ambulatory surgery center is always going to remain responsible for the outcomes, even if you're outsourcing it. So if you have a lawsuit or if there's some type of an infection, it's going to be you that's responsible for it. So you need to make sure that your contract is rock solid and everything is in writing. And you're going to have to do some due diligence. You want to verify that the other organization is going to follow the manufacturer's instructions for use. And of course, you probably are going to have to provide them with the instructions for use for the instruments that you're going to send to them for processing. You also want to make sure that they're following appropriate standards such as ST79 and they're maintaining the proper sterility, packaging integrity, and of course storage. And you also want to confirm that they have a robust quality system, that they're doing biological indicator monitoring, et cetera, that they are operating the equipment properly and that they know what they're doing. And if you are accredited by an accrediting organization, then you're going to want to make sure that that organization, meets whatever requirements you have for the accreditation. If the offsite processor is going to be another ASC or a hospital, you will still need that same level of process verification that you would do if it were an outside company. As I mentioned, you also want to execute a written contract or written agreement, make sure that it goes through the Quality Improvement Committee as well as the governing body, and expect the surveyors to look at that agreement when they come on site. Your contract should clearly cover the following things. Scope, what is being processed and what's excluded. The standards that are being followed, that means the instructions for use and any evidence-based practices. Expected turnaround times and any escalation. Transportation responsibilities. This is actually very important. Who provides the containers, what courier service you're going to be using or who's going to be couriering it. The cleaning of the transport bins and the carts and the vehicle itself, and how that vehicle is maintained. Is it temperature controlled, et cetera? The chain of custody and tracking. You're going to have tray IDs, load IDs, patient case linkage if that's applicable. You're going to want to make sure the quality improvement records are being maintained so that you can move it through your quality improvement process. You also should be able to obtain biological indicator logs, maintenance logs, training, and competency of the people that are doing the sterile processing in that other organization. And what happens if the instruments fail the test, or you find that they are, when you open them up, that the instruments are wet or that there's torn wrappers or missing indicators, how you will handle those situations. And then The contract should also have the right to audit. You should have the right to go into the organization to observe their processes to make sure that they meet all the requirements. And then you also have to have disaster or contingency plan in case problems occur during the processing of the instruments. As part of the whole process, you're going to have to build a transport system to be able to transport the soiled instruments to the sterile processing, recognizing that these are going to be biological hazards. You want to ensure compliance with the OSHA bloodborne pathogen rules and follow whatever requirements you have for the containers themselves that are moving back and forth, and make sure that they're leak-proof and that they're labeled appropriately. Also, you want to align with any applicable Department of Transportation or state requirements depending upon how items are classified or transported, and your compliance team or hauler often helps here. And then you're going to obviously have to deal with the transportation of the sterile items back to the ambulatory surgery center, how they're going to be protected in their packaging to prevent crushing or tears to the instruments, environmental protection to find what you do if the packaging looks compromised, and of course setting forth the receiving inspection at your ASC for every delivery that comes in. AMI has emphasized that transport can compromise packaging, and compromised packaging could trigger reprocessing. So be very careful to inspect the products that are coming back, recognizing that that transport process could result in some damage. You're going to also want to rewrite your policies and procedures and assign oversight. So when it comes to the policies and procedures, at a minimum, you're going to have to deal with the following: instrument handling at the point of use, the soiled transport process, the containers, the labeling, the timing, the exposure and spill response, the receipt and inspection of sterile goods, including what constitutes a reject,
and documentation requirements such as tray tracking, load records, indicator verification,
handling of loaners and implants,
the recall process and who triggers that process,
and vendor or partnering monitoring and an audit schedule. In other words, how you would actually monitor the offsite organization. And before you go live, you're going to want to validate that whole process. You're going to have to walk through it, make sure that you test it to make sure everything works. So do a controlled pilot. Start with 1 to 2 service lines or limited sets of instruments. Verify the tracking accuracy end-to-end. Verify the indicators and documentation that they match what you receive. And then treat it like a drill where you would simulate a failure, such as a torn wrapper, a wet pack, a missing BI, a biological indicator, or the wrong set that's being returned. And then train your staff appropriately to handle that.
And it's a great idea, isn't it, to keep that validation packet, the proof for when you have a survey, you can show them everything you've done to validate.
As well as if you have some type of a lawsuit or if you have an infection that comes out of this, because that's the first thing you're going to want to look at is, was there a failure in the offsite processing? And as I mentioned before, you do want to integrate this into your CAIP, make sure there's ongoing monitoring of what's going on. Put measurable indicators into the CAIP program, such as the percentage of trays delivered completed on time, rejected trays, torn wrappers, wet packs, missing or failed indicators, turnaround time compliance, exposure and spill events, of course, goal being 0, and then results of any audit findings. Surveyors expect the ASC to maintain control and oversight, not just set and forget. And then you'll want to prepare a survey binder. In other words, what surveyors are typically going to ask for. They're going to want to look at the following: assigned contract or service agreement,
and written transport policies and procedures, and the staff training and competencies to go along with that.
Recent audit results of the offsite processor,
evidence of compliance with OSHA container requirements for contaminated transport,
a recall policy, and at least a tabletop drill record of that,
and your CAIP metrics trend.
So I know this is a pretty detailed summary of what's going on, and I probably jumped down a rabbit hole, Sue, when I got into this, but hopefully it'll at least give you an idea of what's involved, and perhaps help you to determine why you really don't want to do this if you can avoid it at all. And just remember, you can outsource the work, but you can't outsource the responsibility. Your governing body or leadership still owns the quality system, and you must be able to explain it. And transportation is a part of sterile processing here. If it's not validated, monitored, and trained like the clinical processes, it's where the citations and real patient risk can show up. So as our regular listeners know, we are doing a series on the accreditation organizations. The first one was a couple weeks ago where we talked with Tom Terranova with Quad A. And today we're going to interview Rommie Johnson with ACHC. But before I get into that, I did want to talk about the difference between deemed and non-deemed status surveys. A non-deemed status survey is conducted by an accrediting body on a voluntary basis, unless it's required by your state or your insurance company. It is scheduled and tends to be more consultative and educational, though that has been changing. And the date is generally negotiated between the accrediting organization and you or your surgery center. Whereas a deemed status survey is unannounced. So a deemed status survey is an accreditation survey conducted by an approved organization such as ACHC, Joint Commission, DNV, ACHC, or Quad A. And CMS recognizes that organization as meeting or exceeding the Medicare conditions for coverage. If an ambulatory surgery center passes a deemed status survey, it is considered to be in compliance with the CMS conditions for coverage without undergoing a separate CMS survey, usually performed by your state agency. This allows ASCs to maintain Medicare certification through continuous accreditation rather than periodic state inspections. In short, deemed status surveys mean CMS deems the ASC compliant because a trusted accrediting organization has verified it. Your state doesn't generally charge to do a CMS survey, whereas an accrediting organization will charge. And that charge will be more than the charge for a non-deemed status survey. And remember, too, that a deemed status survey is going to have both a health surveyor or multiple health surveyors as well as a life safety surveyor. So I just wanted to point out some of the pros and cons of deemed status versus non-deemed status. First of all, remember that you're going to have to pay for a deemed status survey. In other words, if you're asking the accrediting organization to do the survey for you, you're going to have to pay for it, whereas a state agency generally will not charge for it. With a deemed status survey, you're going to know that it's going to be performed every 3 years. But if you're relying on your state agency to do your CMS survey, that can vary dramatically. Some states do it every 3 years. Some states, take a lot longer than that. And remember, both a deemed status survey and a state agency doing a non-deemed status survey, CMS survey, they're both going to be unannounced. One of the benefits of a deemed status survey is you're going to have one survey for both accreditation and certification. If you're not doing a non-deemed situation, you're going to have the accreditation survey, and you're also going to have a CMS survey. And remember the drawback. A deemed status survey is you're going to have less control over the timing of the survey organization, the accrediting organization coming out. And of course, if you're doing a non-deemed status survey in addition to your accreditation survey, you're going to be duplicating some of the efforts there because you're going to have two separate surveys. Let's take a short break, and when we come back, we're going to have an interview with Rommie Johnson with ACHC.
Every ASC professional knows that running a surgery center takes knowledge, skill, and a strong support network. That's why we created ASC-Central.com, a place where ASC leaders and staff can learn, connect, and grow together. ASC-Central is a comprehensive hub for education and professional development in the ambulatory surgery industry. Our leadership bootcamps, on-demand conferences, and membership programs are designed to meet the needs of administrators, nursing leaders, medical directors, business office managers, and anyone committed to excellence in outpatient surgery. Our leadership bootcamps are guided, mentored programs that help develop the next generation of ASC leaders. Whether you're new to your role or looking to refine your skills, these bootcamps provide the structure and insight you need. And many of them offer AEU credits for CASC certified administrators and IPCH credits for CAIP certified professionals, supporting your ongoing professional certification. ASC Central's on-demand educational library gives you access to in-depth programs on compliance, quality improvement, infection control, credentialing, finance, and more. These full-length virtual conferences are designed to be both informative and engaging, not just check-the-box webinars. Many also include CASC and CAIP continuing education credits. For those who want ongoing learning and connection, ASC Central offers flexible membership programs. The Patron membership gives you access to Zoom discussions, key conferences, and a robust resource library. The Premium Access membership adds full access to all boot camps, private consultations, staff training, exclusive content, and ongoing support from top experts in the ASC field. If you want to be part of a community dedicated to raising the bar in ambulatory surgery, visit ASC-Central.com or email us at info@ASCPodcast.com. ASC Central, bringing ASC professionals together to learn, grow, and thrive.
I'm here with Rommie Johnson from ACHC. Welcome, Rommie.
Thank you, John. Thank you for having me. Happy New Year to you and all your listeners.
Thank you so much. As you well know, we are doing a series on the various accreditation organizations, and you and I have talked in preparation for this to try to get an understanding of how ACHC works, what's different about it, and what the experience is being an ACHC organization. So first of all, introduce yourself to our audience.
Thank you again. Well, as you mentioned, my name is Rommie Johnson, and I have the privilege of serving as the program director for our Ambulatory Surgery Center and office-based surgery programs at ACHC. I'm actually located in the Chicago area, but ACHC itself is headquartered in North Carolina. So this year will actually be my fourth year, but prior to that, I've spent several years in a unique position within different accrediting organizations. So I've had the privilege of having different perspectives as to the approach when it comes to helping surgery centers become accredited, have that safe patient care, and maintain that accreditation long term. So again, thank you for having me.
And Rommie, you and I have known each other since the beginning of your career at ACHC. So it's been a pleasure getting to know you and, of course, getting to know ACHC. For our listeners, we do work with ACHC. We have a number of centers that use ACHC, so I do have some very direct experience with it. Can we start out by talking a little bit about the history of ACHC?
Sure, absolutely. So, it's been interesting to see it not only from the outside, but also once I joined ACHC. ACHC was actually founded back in the 80s, 1986, but at the time it was more home care focused. So the program's home care was the largest program at the time. But over the years, either through just working with different accrediting organizations or acquiring certain organizations, they've grown to add to the portfolio. So back in 2020, that's where, as far as ASCs are concerned, ACHC merged with HFAP. That's the Healthcare Facilities Accreditation Program. They were also in the Chicago area. And HFAP, sort of merging their programs with hospitals, surgery centers, and labs, and with ACHC's resources, kind of came together to have this new program where, folks that want a different type of accreditation experience can work with ACHC. And we'll talk a little bit about what different means. But yes, so back in the 80s and then in 2020, just around the COVID time, or after everything with COVID was happening, there was the merger. Now, as far as the program itself for ASCs, for those that are interested, it has been deemed by CMS since 2003. So when that merger happened, that deeming approval kind of went through. And then since then, CMS has actually come in and take a look at our process and reapproved it again. So a big question that we get is, you guys are new, where are you located? And by the way, are you approved?
Yeah,
so, right. Exactly. So yes, we are approved by CMS and a bunch of other private payers as well. And so that's really at a high level. Beyond that, we also do offer certification programs. So as of this sort of conversation, we accredit over 26,000 facilities across all programs. I think ACHC is only one of two accrediting organizations that accredits across the continuum of care. And then we have several certification programs. So for the listeners in the surgery center world, we also have a joint replacement certification program. So, that's another offering. And then, of course, I mentioned office-based surgery. So these are the small practices for those that are interested, especially if you're in California, New York, Florida. Those are some of the states that may have mandates around that. And then beyond that, it's just, we also have educational arms. So, I like to say, even prior to joining ACHC, accreditation has to have a value beyond the certificate on the wall. And so for ACHC, the way we approach that is through our educational arm called ACHCU. So that's where we usually will have at least 60 to 70 webinars published every year. We'll have an annual educational program. As of now, for the surgery center world, we have it more webinar-based, just because after COVID, we're trying to kind of get that interest to see who would be interested in coming in person. And then we also have Health Train You. So this are it's a learning management system for anyone that wants to earn credits as well. At a high level, that's really what ACHC is about.
And though most of our listeners are ASCs, some of them also have office-based surgery. Can you talk a little bit about the OBS program and what states you're in right now?
Absolutely. So the OBS program, that has been a little bit of a slower evolution, as far as kind of getting the states that mandate accreditation to approve ACHC. Some of it has been just working to change the name, like I mentioned before, from HFAP to ACHC. But currently, we are approved in all the major states that require accreditation. So California, like I mentioned, Florida, New York as well, Washington, Oregon. And I believe there are about 9 to 10 other states that I'm forgetting right now. But anywhere where the legislation says you have to be accredited, we are listed there. I will say there are a couple of states that we're also working on right now. So Alabama being one, Alabama and Georgia. Those are actually two that we're currently working with their team, with the state representatives, to make sure that they add ACHC as an option.
And you're growing very quickly too, right? In the ASC world or the ambulatory surgery world.
Absolutely. When I looked at the numbers, since 2020, since that merger, I think year on year, we are growing at between 25 to 30%, adding new ASCs. So it's definitely been a rapid growth. And a lot of that is coming from, single ASCs, so these are ASCs that are not affiliated with management firms that are looking to have an expedited survey process, looking to kind of get going quickly. And so those are the ones that like our process, and so they kind of come to us. But yes, you're absolutely right. When you look at the numbers between 25, 30% growth year over year. And then just kind of going back to the OBS, one thing I failed to mention, all your listeners will know, especially if they've gone through deemed status. The deemed status process is usually unannounced. It has to be unannounced because of CMS. But we do have, I'd say, between 5 to 7% of our ASCs that choose to come to us for non-deemed. And so for that, we'll work with them to schedule the survey. Same thing with the OBS side. That one it's announced. So you get to kind of get your team ready, make sure that anyone that needs to take vacation takes it and can be prepared. But for the deemed status, it is unannounced. And that's the case for all the AOs.
How many ASCs do you accredit at the present time, if you know that number?
I want to say around between 155 and last time I checked was around 155, but that was a few months ago.
Right.
I can certainly get an updated number for you, but I'd say about that. And like I said, if you look at the number of new, though, it's been incredible to see that number grow. Yeah.
I know. When you and I first talked, the number was in the double digits. So yeah, you've definitely grown quite a bit in the last couple of years. And just out of curiosity, which state do you think you have the most ASCs, if you happen to know that number?
Definitely California.
Okay.
I'd say California is a
that would have been my guess, yeah.
Yes, absolutely. California, I want to say we have California, Georgia as well. We work with one large ASC group that's headquartered in Georgia. So we have quite a few of their surgery centers as well. But in general, I'd say California is our best performing state. Mm-hmm.
So this is a good question for you. What do you think is driving your significant growth? I think it's fair to say you're the fastest growing of the organizations out there.
Yeah, I was thinking every time that question comes up, the 3+1 reasons, that if I could say that,
sure.
The 3 top reasons plus a bonus one, I think the first one is really customer service. And I know everyone says customer service, and at this point, it becomes almost like a buzzword. But if I could dig a little bit deeper, when I joined ACHC, one thing that I noticed is there's really a big emphasis on response time. Now, doesn't mean we always get it right, but really, from a leadership perspective, one of the things that they drive home is we need to be responsive. We have a lot of surgery centers, and you know this, administrators that wear multiple hats. And so when they have a question, it's imperative that we respond accordingly. And the other piece of it is just getting someone on the phone call, on the phone. We hear a lot about, when I work with certain AOs, or I get an email or maybe a worksheet, but being able to get someone on the phone, I think that's something that's really driving that, building that rapport with the ASCs. So, customer service, I said, the response time, getting someone on the phone. And then I know you and I, were talking just recently about, we have a pre-survey call process as well. Yeah. So for those that may not be aware, if you choose ACHC, beyond just looking at our standards, we actually offer a complimentary pre-survey call. It can be 30 minutes to an hour. It's up to you. But this is where you meet with our clinical team and go over any questions you may have. And so, a lot of folks find that to be helpful because, you may have prepared, but it's also nice to just kind of talk with the internal team, kind of see what I's you need to dot, what T's you need to cross. And so having that being complimentary and part of the process is definitely something that's driving people to say, you know what, I want to work with this accreditor. They're not just looking at standards and then leaving. And then I'd say the other piece of it is feedback. And what I mean by that is, after every survey, so for example, let's say an issue came up during survey and I was notified, as the program lead, I might address the issue. Maybe it's with a surveyor, maybe it's with the standards, whatever the case may be. But even after the survey, our quality team, we have a quality division that will reach out to anyone that scores a certain level in the survey. And we'll just find out, hey, was your issue solved? Is there anything else we could have done better? And so I think long-term, a lot of administrators and surgery centers find that to be helpful to say, hey, it wasn't just they came in and left. An issue came up, it was addressed immediately, but also after that, they followed up with us to kind of make sure that everything is good to go. So I think when you think about customer service, that's really one big thing. I mentioned there are 3 areas. The other piece of it is alignment with CFCs. Now, obviously, we want to make sure that surgery centers not only have safe patient care, but as you know, a lot of folks also want to say, hey, what do I need to do to be compliant, at a state level, federal level? And so for us, our standards are really closely aligned with the CFCs. I'd say probably 90 to 95%. We do have a few extra here and there. But beyond just being aligned to the CFCs, I think the other value is when you look at our standards, and for those that are not familiar, we have sections called required elements. So this is where when you're doing a mock survey, for example, or when you're looking at our standards, it's not enough to just see what the CFC is, the conditions for coverage, but it will actually tell you what our surveyors will look out for. And so there are no surprises. And it will tell you how you can be compliant so that, as you're putting together a mock survey, you know exactly what to expect. So I think people enjoy that. And then finally, I mentioned this earlier, we have what we call the TIME program. Now, accrediting organizations, we love acronyms, and this is another acronym. So TIME stands for Time is Money Earned. And basically, if I could just summarize in a nutshell, it's our program where as a new ASC, you're looking to become deemed, you're looking to start billing as soon as possible. This is an option where we expedite the process. And so what that will look like is the scheduling piece of it, we expedite that, obviously making sure that it's still unannounced, but we expedite the survey process. We expedite the review process. So after the survey is done, you get the plan of correction document or report, much faster than if you did not opt for that program. And then on the back end, right now we have our accreditation review committee that will sort of review all the reports and approve the accreditation. Even that gets expedited. So instead of meeting every 2 weeks like they do, if you have your ASC come through the TIME program, we can schedule an emergency call that Monday or that Tuesday instead of waiting till Thursday. That way we make sure you get the letter and the original office gets the letter saying that you're approved. So I said those are the top 3: customer service, alignment with CFC so that you know exactly what you're getting, and then that speed to survey.
Yeah, and if I could just put a personal note in, those are exactly things that I've observed too. The rapid response that we get, and yeah, when I call, I know you, but I've tested this. We've asked some of our our clients, okay, do they respond? And it doesn't seem like I get any special privileges, Rommie. And I think people appreciate that there's always somebody at the other end of the line that's going to get back to them very quickly. I think that's a very important element. And I also want to tag on to we've also experienced new start organizations, and you do indeed expect. Given that we've have experience with all of the accreditation organizations, I would say that our experience has been that you respond faster than the other organizations at this point. So that's very important. I want to go back to something that you mentioned earlier, which was kind of interesting, is that. Not that you don't work with management companies, but you really mentioned that a lot of your growth is coming from those surgery centers that don't have a management company behind them. And I think that's kind of an important thing to point out, is that people come to you because I think, again, just as you've mentioned, there's a personal element. You've got the education programs, the university. You respond to questions very quickly. That might not be the experience that many, if you're part of a management company, the management company handles that. But if you're your own ambulatory surgery center, if you're not affiliated with a big organization, you are probably looking for a little bit more help. And I think that's perhaps one of the drivers of your growth. Am I correct?
Absolutely, you're correct. And I think the other element of it is sometimes you don't know what you don't know. And so, I'd say right now from a management company side of things, just being transparent, a lot of them are used to sort of the big two, big three, organizations. And so, when they open up or when they acquire surgery centers, they're likely, and it's understandable, they're likely to say, hey, we would want you to go with this accreditor. So, and that's part of why, doing some kind of engaging with you, talking to you today, going to conferences, participating in the ASC Quality Collaborative, it makes ACHC kind of stand out and say, hey, there's an option out there. But back to the other side of things, you're absolutely right. When you have a single physician, maybe they have 5 staff members, they want all the help they can get. And so part of that is ensuring that our process really caters to that. For us, we can hold folks accountable. I always tell my surveyors this: you can hold an ASC accountable, but do it in a way that when you leave, they actually are excited to have you come back. Or when you leave, there's something they learned. And so that's something that definitely, to your point, for those single owner facilities that are not connected to a management firm, certainly they see that benefit. But in the future, who's to say that if one of the larger firms decides, hey, what's ACHC about? Certainly we can work to kind of have a process for that. But for now, I think it's also a case of you don't know what you don't know. And right now, a lot of them might not be as familiar, for example, as my other AO counterparts.
So what if you're, as you do, if you're trying to sell your organization over the other organizations, what are those things? I mean, you've already talked about some of it. What really makes you different from the other 4 organizations out there?
Yeah, I think that, to your point, I kind of talked about some of the value adds. If I'm an ASC, for example, and I'm looking at all the accrediting organizations, including ACHC, I think the first thing I'd want to find out is, first of all, ACHC, are you approved by who needs to approve? And so the answer is yes. So right off the bat, that kind of removes a lot of the hesitation to kind of say, hey, am I spending my time, resources on an accreditor that's approved? And the answer is yes. I think the other piece of it is, what type of support am I going to get? Now, I know, my colleague, Tom mentioned, I heard the podcast, and he mentioned, sometimes you obviously don't make it all about the financial piece, but the reality is, just with everything going on, a lot of administrators, owners, that's something that's also at least top 3 in their mind. So we think about that. And so to address that, we make sure that there are no annual fees. So the other piece of it will be like, okay, well, this is how much I know I have to pay, no matter who I go with. But how does that look like? Is it comparable? Do I really get value for money? Will you charge me annual fees? And so for ACHC, there are no annual fees. There are no additional surveyor travel costs. So that might be something that maybe might say, okay, this is a difference compared to one or two of the other accrediting organizations. The other piece is the pre-survey call. Yeah. Okay, so I've decided to apply and pay. Will you charge me for this call, for spending an hour of your staff time? How many emails, questions can I send out? And so for us is you can send as many emails as you need to make sure that you're prepared. So again, that would be another component, which is kind of connected to the customer service.
Right.
But, just to summarize, I'd say, once you've kind of gone through, hey, are you approved? Because that is major. You do not want to go through a process only to find out an accrediting organization is not approved or deemed or what have you. But once you've kind of passed that hurdle, it's all about, okay, what support am I going to get for this survey? And also, in 3 years' time. And so for us, and I believe all, if not most of the other AOs do this as well, but, for example, we'll publish the top-sided standards every year. So that's something that's, I think it's valuable. And I tell people, even those that are not accredited or looking to become accredited by ACHC, I say, go to our website. It's free, download, take a look at it, because there's so many tips and tricks you can get from that for me, at the end of the day, if you can learn from that, even if you're not with us, that's a win for me. And that's a win for ACHC. So, yeah.
Yeah, I that's actually where I was going to, is that the the education component is very important. The access to your standards even before you sign up for
exactly.
You don't have to pay for it. You can look at it. You can compare it to the other organizations and
exactly.
see whether that would be useful. Let's another part of this is the survey experience. Can you talk a little bit about how your survey experience might differ, or how much of it is the same as other organizations? Because I do think that that's a very important part for a lot of our listeners, is what is it going to be like when the surveyors are on? So talk a little bit about your surveyors, talk a little bit about the survey experience.
Absolutely. So, our surveyors, I'd say, like I said, if you're going through the deemed status program, it's going to be unannounced. So that process of showing up in the morning is pretty much the same as all the other grading organizations. I think one of the first differences that ASCs will notice with us, with ACHC, is that we usually send out two surveyors, so two clinicians that are cross-trained in life safety. And the difference for those that may not know, the listeners that might not know, most of the AOs will usually send two clinicians and then a life safety code surveyor who may come in on day 2 or day 3, depending on how the survey is set up. For us, our surveyors are cross-trained. It's something that CMS has looked at and approved. And so that's a key difference there. And so, it just kind of makes the survey experience a little bit more smoother. You know exactly these are the two folks that I have, for these 2 days, and the whole experience is done within that time period. And then I'd say a key difference really that comes up, and I mentioned earlier in my introduction that I've had the privilege of kind of being with different accrediting organizations. And when I joined ACHC, one of the things that I really drove home is what makes us different. What would make an ASC choose us for this experience? Because it's a long-term process, and the answer there is how collaborative our surveyor is going to be. So, I mentioned holding folks accountable. We have standards, we have the conditions for coverage, but also as you're going through that, are you being collaborative? Are you kind of offering more than just what the standard states there? And so I think that's something that's big. That's something that we really hone in on our surveyor training. Now, sometimes do things happen, and you might have a surveyor that's having a bad day. Yes, of course, no one is going to be perfect, but really at the core here is you have to be collaborative. That collaboration part of it, that education piece, has to be really embedded in that survey experience. So I'd say, from a survey perspective, you have two clinicians that work in the ASC space, but happy to be cross-trained life safety, will be coming to take a look at, your center. And then you just have the experience of being collaborative and educational. And then even that expands, I think, and you may touch upon this later on, consistency. I heard my colleague Tom talk about it. We all struggle with it, just to be transparent. But one of the areas where ACHC tries to close that gap between, as far as consistency is concerned, is really in that pre-survey call that I mentioned, the same clinical team that handles that pre-survey call to help you get started, to help you be ready, they're the same team that will look at the plan of correction on the back end. So, more or less, you have that consistency where, if you're working on a plan of correction, whatever you're putting together long-term or short-term is going to be relevant and is going to be with the same folks that you spoke with in the beginning of the process. So that's one area where we try to bridge that gap a little bit. And then obviously every 3 years, kind of working with the surveyors to remind them about their role and that they represent us and that you as a surgery center have spent an enormous amount of time and resources. And so it needs to be an experience that reflects that.
So I think let's delve into that a little bit deeper. The surveyors that come out, they have experience in the ASC world, and they have a specific training, obviously, working with ASCs, correct?
Correct. That is correct. Now, one thing that usually will come up, or a question that I'll hear is, will I get a peer-to-peer surveyor, someone that's, and that it's tough to always kind of have that match. And I think that could be the case with all the other accrediting organizations. But at the very least, these have to be folks that understand the ASC world. They understand the struggles that you work with, the constraints and all of that.
Now, are they nurses, doctors? What credentials do they have in general?
So majority of our surveyors are nurses.
Okay.
So that's, typically nurses, bachelor's and master's trained. We have a few that also, have specialty in, infection control, so SPD process, making sure that, so they might, hone in on certain areas, but yes. They're typically nurses.
Now, your life safety surveys are different. So, and you touched on that a little bit before. Can you talk us through how the life safety component would look to the surveyed organization? This is for a deemed status survey.
That's correct. Yeah. So, I'll start with just quickly touch upon the training process. So, I mentioned our surveyors are cross-trained, and so we utilize the QSEP, the CMS QSEP for training with that. And then we actually also have an in-house life safety code subject matter expert. So this is the person where during that pre-survey call, he may join in kind of to answer any questions we may have. But as far as the survey process is concerned, typically it will be, obviously as the surveyors are doing the walkthrough, it's just a lot more efficient to kind of note some of the requirements. And then they might ask for either you as the administrator or your facilities manager to kind of walk you through some of the other finer details, including even looking, climbing up a ladder and things like that. But it's pretty, we try, the way the agenda is set up is we try to be to not be as disruptive and, to kind of make sure that the patient flow just works out well. So that one person or two people are not being pulled away from their duties. But it's the way it's woven there and the way you'll see in the agenda. It's just as the survey day kind of moves forward, on day one and day two, we'll look at some of those components for life safety. So it's pretty efficient.
And I think that's an important element to point out is that often when there is a specially trained life safety person and you're in a small organization where the administrator is both a clinician as well as the life safety person, it's a little easier when it's the same person asking a lot of those questions.
Exactly. Precisely.
So, Rommie, before the actual survey, there's a form, though, that is filled out, correct, for the life safety team to review in the main office before the surveyors actually come out.
That is correct, John. We call it the facility demographic report. It's about 7 to 8 pages, and it kind of goes through a lot of the specifics about your center. So, for example, there's questions about whether you have any sprinklers in the facility, whether it's protected with a fire alarm system. So and it's pretty neat. It's a PDF. It kind of has check boxes. You can fill all that. And our team, including our surveyors, will take a look at that. So again, going back to that efficiency piece, a lot of the information they can be gathered prior to the surveyors showing up on site. And of course, it's just a quick check once they're on site. But we call it the facilities demographic report. Something that I'm always willing to share with anyone that wants to take a look. But you're absolutely right, John.
That's a good point. So one thing I always, working with all the accreditation organizations, tell me a little bit about the website experience and the interaction with, we call them accreditation management systems, at least in some of the other organizations. I don't know if that's the same term you use, but talk about the experience that the surveyed organization is going to have with that website and how that assists in the survey process and after the survey process.
Sure, absolutely. So right now we use what we call Compass, and it's all electronic. So what that means is, as an ASC, as you're coming through, the application is going to be electronic. Now, are there areas where we could make it more efficient? Absolutely. So, for example, kind of tracking your progress. But I would say, it's pretty easy. You'll know exactly what to upload, which staff members to add into the profile, and that will be your profile moving forward. This is where any updates or any changes you'll be able to enter in there. This platform is the same one that we use on the back end as well. So this is where you get the plan of correction, which again, it's all electronic. So you're not having to mail anything or ship anything. It's all electronic there. And that's when also you'll also get your decision letter as well. So in a nutshell, everything is all online. Now I will say, hint, or sort of a preview. We're always looking for efficiencies, and part of that is we're working currently on a new platform that will hopefully make things even easier for our facilities and our surveyors. Meaning, when you're looking for questions around standards, it will be your one-stop shop to where you can quickly go in. You don't have to pull up the PDF manual. You can just kind of type in your question and you get a response. This is where you also get all information about any regulatory changes that are happening. So this is something that's coming up. I don't have a timeline yet, but certainly it's something we feel will be very useful to our organizations. But at current state right now, everything's electronic. There might be areas where you upload a PDF or a Word document, but again, it's nothing all of us are not used to. It's things that, again, we have worked with before, so it should not be unfamiliar to most of the listeners.
So, Rommie, talk a little bit about how the surveyed organization interacts with the accreditation management system after the survey.
Yes, so after the survey, you get your decision, and pretty much if you're in a situation where the plan of correction was addressed and ACHC and the Accreditation Review Committee has approved that, we then send that to CMS, and so there's no further action on your part. Especially, I know in some cases, some accrediting organizations might have an annual requirement, either an attestation or to submit a report. For us, we don't have that in place. Now, it doesn't mean that we leave you hanging. I mentioned earlier, any annual helpful resource, such as this, the quality review with the top cited standards, we send that to you on a monthly or bi-monthly basis. We also would send articles that are helpful to you, as well as webinar articles or webinar series. But as far as you having to submit something on an annual basis or attestation, we do not require that. Again, it's just we work with you, make sure any resource we can provide is provided to you.
So, I think that's a good differentiator. That you maintain an ongoing relationship, but you're not bugging people all the time with exactly. Unnecessary stuff. But you're providing great information. And I did want to point out, you mentioned earlier that you provide information about the top findings, and we reported that, I think, a couple episodes ago here. So you're very gracious to provide that information to the whole world. It's not just your accredited organizations, but everybody Absolutely. Out there, so they can see what types of findings. I always find that we always find it very interesting. Those episodes where we talk about findings tend to be some of our more popular episodes. So thank you for providing that information, Rommie. This has been fantastic. As I said, I've had great experience with ACHC. I do think that you are the fastest growing out there. We'll see what happens with DNV coming on board, but of course they serve a very different audience. But can you just mention to our listeners how, if they're interested in learning more, talk about the different ways they can do that and who they could contact, and I'll provide some links in our show notes too.
Absolutely. So in addition to the links that John will provide, the best way, it's achc.org. Pretty easy to remember. And we have a specific ASC page where you can reach out to us. There's an email where our team will take a look at that. You could also reach out to me directly. Like I mentioned, for us, even above me, it's being able to have that customer outreach is really important. So that's another great way to reach out to us. And then take a look at some of the articles and series that we've put out there. That's another great way. Again, whether or not you're making a decision to look into ACHC, it's just something that's free and that's helpful to you and your staff. But yes, certainly reach out to us with the information that John provides. We'd be happy to answer any questions or provide any more insights.
And Rommie, your team attends many state association meetings and, of course, the national organization too. So our audience should feel free to stop by at those organizations that you're able to get to.
Absolutely. Please stop by. ASCA, CASA, we usually attend those. Please stop by. Whether it's questions, typically we'll have a little bit more information as well while we're on site. Definitely stop by and see what's out there. Again, I think, John, you mentioned it, the more organizations are out there, especially the more choices that ASCs have, the better. It really keeps us on our toes, and it forces us to be innovative, but also to think about what value are we actually giving you as a listener. So I'm here for it.
Yeah, as we introduced this series in in a previous episode, that I think has been very good to the industry to have more than a few accreditation organizations out there. Everybody has to stay on their toes. Competition is always good when it comes to this, and customer service has become a very major issue, I think, for the accrediting organizations.
Absolutely.
Thank you so much, Rommie, as always, and I'm sure I'll have you on again soon.
Thank you, John. Thank you, everyone, for sharing your time with me, and hopefully we get to connect.
Sounds good.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff, and other events in the ASC industry.
If you're interested in taking the CAIP exam, or the Certified Ambulatory Infection Preventionist exam, the next exam period is from March 1st through the 31st, and applications must be submitted by the end of January 31st. The exam is offered each March and October of each year. And by the way, if you're interested in some training to prepare yourself for the CAIP exam, visit ASC-Central.com for some training programs and infection prevention.
And the OR Business Management Summit in Austin, Texas is February 9th through the 11th, 2026. Registration is open until that day.
And just a note, I'm doing a pre-conference there. It's going to be a workshop on financial management. And the American Academy of Ambulatory Care Nursing, or AAACN's annual conference is April 14th through the 17th, 2026 at the Hilton Orlando in Lake Buena Vista, Florida.
And the ASCA and SAMBA Joint Conference and Expo is May 13th through the 16th, 2026 in Washington, D.C.
And we will be there. We're going to have a booth for the podcast and for ambulatory healthcare strategies, and I'll be speaking at that conference on strategic planning. And the Gulf States ASC Conference, that is Alabama, Louisiana, and Mississippi's conference, is going to be June 17th through the 19th at the Ritz-Carlton in New Orleans.
The Florida Society of Ambulatory Surgical Centers annual conference and trade show is July 22nd through the 24th at the Hyatt Regency Grand Cypress in Orlando, Florida.
And the California Ambulatory Surgery Association's annual conference and exhibits is going to be September 2nd through the 4th in Monterey, California.
The Pennsylvania Ambulatory Surgery Association's annual meeting and educational conference is October 4th and 5th at the Eden Resort in Lancaster, Pennsylvania.
The Atlantic States ASC Conference, which includes North Carolina, South Carolina, and Virginia, is October 8th through the 9th at the Embassy Suites at the Raleigh-Durham Research Triangle in Cary, North Carolina.
And the New York State Association's conference is November 17th and 18th, 2026, with the pre-conference on November 16th at the Desmond in Albany, New York. And we'll be presenting the pre-conference. Yeah.
And definitely follow what's going on in ASC-Central. Our website will be announcing the various conferences for 2026 very shortly. Keep visiting it, and you'll see the conferences popping up as they're scheduled. And don't forget, on-demand versions of the ASC Director of Nursing, the ASC Administrators, and the ASC Business Office Managers bootcamps are available on our sister website at at ASC-Central.com. And remember to everyone to become a patron member of the podcast. Don't miss out on all the benefits of joining our Patron Program, which is available at ASC-Central.com. This comprehensive membership platform is your go-to resource for all aspects of ASC regulatory and accreditation, compliance, operations, and financial management. And it's designed for the busy schedules of administrators, nurse managers, and business office managers. By becoming a member, you gain access to our regular Zoom sessions, usually weekly, where you can engage with other patrons and our podcast team. But that's just the beginning. Our membership unlocks a wide variety of resources, including some of our virtual conferences. And you also find valuable tools like sample policies, procedures, forms, and, of course, our very well-known fire and disaster drill kits. Your support helps us maintain and grow the podcast, covering essential costs like research, travel, equipment, and production. To learn more and to become a member, visit ASC-Central.com.
Thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC community and be sure to subscribe so you never miss an episode. We appreciate your feedback and any suggestions for future topics. Reach out anytime at comments@ascpodcast.com.
A special thank you goes out to our incredible team here, our sound editor, Susan Cronkite, executive producer, John Goehle, and our committed research team of Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Mike D'Ambrosio, Zach Calritis, Jim Masters, Stuart Rosenberg, Amy Cronkite, Lori Rodericks, Kathy Foti, Donna Macchio, Christina Norman, and Katie Pearson. Your hard work makes this podcast possible.
Our theme music is by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and can be found on all major podcast platforms. Thanks for listening, and we'll see you in the next episode. This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.